Okay, so this is an assessment of the 12 cranial nerves on my patient here. Thank you so much for helping me again this time. We're going to start, we're going to start first off by assessing cranial nerve number 1, which is the olfactory nerve. So what I'm going to do is have you close your eyes and I'm going to hold a cotton ball under your nose and you tell me what you smell. Okay? Go ahead. What do you smell?
Vanilla.
Very good. Keep your eyes closed. And what do you smell?
Lemon.
Very good. Okay, perfect. So the olfactory cranial nerve number 1 is intact. And we're going to move on to test the cranial nerve number 2, the optic nerve. So I have a Snellen chart hanging here. If you could stand right at the edge of this carpet like we have marked. And what I am going to have you do is cover your right eye first. And I'd like you to read the lowest line that you can see.
Okay.
They're numbered on the side there.
Let's see. Number 8, sorry.
That's okay. Go ahead and read it.
Okay. DEFPOTEC.
Okay, that's perfect. So as she's reading line 8, that lets me know that she has 20/20 vision, that she at 20 feet away she can see something just fine. And go ahead and cover the left eye. And what is the lowest line that you can read?
Also number 8.
Okay.
DEFPOTEC.
Okay, great job. And you don't wear glasses or anything?
No.
Obviously. Do you have contacts in?
No.
Okay, wonderful. Okay, so the next thing that I want to do for checking the optic nerve is I'm going to check the visual fields. So if you could stand here with me, I am going to hold my fingers in your peripheral vision, and I want you to just stay right here looking directly at me and tell me what you see. 2. Okay. And now, just keep looking at me.
Oh, geez, 2.
Very good. And now I'm going to hold some fingers up over here just to see what you can see.
3.
Okay, great job.
4.
Very good. Okay, and your eyes were right here looking at me the entire time, so that's very good. I also want to inspect the pupils. So I'm going to use my light, and while I'm inspecting the pupils, I can actually go ahead and see that when I shine the light into the left eye, both pupils are constricting. And let's see for the right. Both pupils are constricting when I shine there as well. Now what I'm going to do is bring the pen light to your nose. I'm testing for accommodation. And I'm going to make sure both eyes go in. Okay, very good. Awesome. All right, so the optic nerve seems to be intact, and I was also testing the extraocular motor function of the eyes, which is the cranial nerve number 3, the oculomotor nerve, and as well as the trochlear nerve and the abducens, those are the nerves that help with the eye movement. So that's what the pupillary response test was, and the accommodation test that I just did was to test those. So that was those cranial nerves. And now what I'm going to do is do a test for your trigeminal nerve. I'm going to put my hands on your face and have you clench your jaw. And then I'm going to do a field test with a Q-tip and a sharp end of a Q-tip. And I just want to make sure that you're feeling it appropriately. So let me go ahead and have you clench your jaw. Okay, that feels good. All right, unclench. And can you open up? Wider. And close. Okay, great. All right, and now I'm going to see how you are with that cranial nerve with feeling. Okay, I'm going to have you close your eyes and tell me what you feel on your face. And before I do that, though, I want you to feel that this is a sharp feeling and this is a dull feeling.
Okay.
So I'm going to touch your face and you let me know where you feel it and which sensation you feel.
Okay. Dull on my left cheek. Sharp on my right cheek. Sharp on my chin. Sharp on my forehead above my left eye. Dull on my forehead above my left eye.
Okay, great. Perfect, thank you. Okay, so that is the trigeminal nerve. And now I'm going to assess cranial nerve number 7, the facial nerve. So I'm going to have you go through some different motions and movements with your face. So look at me and smile. And now I would like you to frown and furrow your brow. Okay, good. And now if you could grimace and show your teeth. Okay. Now puff your cheeks out and purse your lips. And raise your brows. Great. Now close your eyes very tight and don't let me open your eyes. Okay, very good. So that is a test of the cranial nerve number 7, the facial nerve. Next, we're going to test your acoustic vestibulocochlear nerve. That would be with the Weber test or the Rene test. In order to perform those tests, we would need to have a tuning fork. So I would ping the tuning fork and check to see if the sound lateralizes. But what we're going to do instead of that with a tuning fork, in order to test your hearing, I'm going to whisper a word off to the side of you without showing you, and I want you to tell me the word that I'm saying.
Okay. Ear canal.
Okay, and I'm going to try on this side. I'm going to say a word, and you tell me what I'm saying.
Pillow.
Okay, wonderful. All right, so the next cranial nerve that we're going to test is the glossopharyngeal nerve and the vagus nerve. So we're going to test your swallowing and the rise of your palate and the gag reflex. So first I'm going to start by testing the gag reflex, and I'm going to have you say ah, and I'm going to use one of my cotton tip applicators, the clean one that I still have here, and I'm just going to test to see how you do with your gag reflex. So if you could say ah. Okay, sorry about that.
That's okay.
So your gag reflex is intact, and that's actually very important, especially for people that have any issues like after a stroke. Without the gag reflex, you can very, very easily choke on something. So that's why it's so important for us to test that. So thank you so much for letting me do that to you. I apologize for that. Okay, so we tested the gag reflex, and I want to have you take a sip of something. So I'm going to grab your drink over here, and I would like to have you just take a drink and show me that you can swallow that. Okay, perfect. No trouble with that at all. And we're just about finished up with the cranial nerves. So what I'd like to do now is I want to test your spinal accessory nerve. So I'm going to test your shoulder and neck movement. What I'd like to have you do is shrug your shoulders for me, straight up like that, and then down. And now I'd like you to do that again against my resistance. Okay, great. And now I'd like you to turn your head to the right that way. And now turn your head to the left. Okay, now back toward me. Look up. And now down. And what I'd like to have you do is look straight at me, and I want you to turn your head to the right against my resistance. Okay? And now the other way against my resistance. Okay, perfect. And I'd like to take a little step back. I want to test the strength of your tongue for the, that was for the glossopharyngeal nerve. What I want you to do is push your tongue into your cheek against the resistance of my hand. Okay? And now on this side. Okay, perfect. So you've got good movement there with that. Okay, so the shoulder and the neck movement appears to be very good, and we'll go a little more in depth in depth with that when we go into the musculoskeletal assessment. So we'll move on to the hypoglossal, the number 12. So I'm going to have you, and this is where actually I would have you push your tongue into your cheek. So I thought I forgot it, but I hadn't. This is the one where I want to have you do that. So the 12th cranial nerve is your hypoglossal, and what I want to do is I want to check your tongue symmetry and position. So go ahead and stick your tongue out for me, and point it up and down. And now if you could go to the left and to the right. Okay, great. And then I already had you stick your tongue into your cheek for me, and that was really good. Thank you very much. And that completes the assessment of the 12 cranial nerves. So I see here that all 12 cranial nerves are intact. And now we will begin the mental status assessment as well as the neuromuscular assessment on my patient. Okay, I would like to tell you 3 words, and then we're going to talk a little bit. I want you to remember these 3 words so you can say them back to me later, okay? Table, quarter, pony. Go ahead and repeat those now.
Table, quarter, pony.
Okay, great. Now, can you tell me what the day and year, what's the date today?
April 9th, 2019.
And I don't want to ask you your name or anything. What state are we in?
Ohio.
Okay, and who is the president?
Donald Trump.
Okay, thank you. And now can you tell me those 3 words that I mentioned to you earlier?
Table, quarter, pony.
Okay, great job. So the patient is alert and oriented ×3. She's alert to person, time, and place, as well as environment. So she's alert and oriented ×4. So we're going to begin our musculoskeletal assessment. I just want to inspect your posture and everything. So if you could please stand. Okay, and I am just going to do a complete 360 review. And I'm just looking to see where your posture is, how you're standing, and everything like that. And I want to assess for symmetry in your iliac crests as well as your shoulders. Okay, great. And now what I'd like to do is I'm going to palpate the spine just to see where everything is. Seems to be straight. And you do have this just a small nodule back here, and this is something that you have discussed with your physician, you told me earlier.
Yes.
Okay, so we're not concerned about that. That's on the lower spine. Okay. And I am finding that there is symmetry along the spine and with the muscles of the back. I'm also palpating the spine and the muscles for any tenderness. Do you have any pain or tenderness anywhere that I was touching back here?
No.
Okay, great. All right, and now what I'd like to do is check the range of motion of your cervical spine. So if you could put your chin to your chest for me, and now your eyes to the ceiling. Go ahead and look all the way up with your entire head. Sorry, put your head all the way back. You can put your head back. Can you go any further? Okay. Now look at me. And now put your right ear to your shoulder. Yeah. And now your left ear to your shoulder. Try to keep your shoulder down while you're doing that. Good. Now I'd like you to look right with your whole head. Turn your whole head and look right. That's okay. And now turn your whole head and look left. Okay, great. Perfect. And now I am going to have you turn right and left, pushing against my hand. I know we did this a little bit earlier. And now let me have you turn left, pushing against my hand. Okay, great. So that's with resistance, and you did very well. Okay, so I thought I lost a few of my cards, but I did not. Okay, so next what I want to check is your thoracic and lumbar spine. So I'm going to have you do a couple of movements just to see where you are with everything with your lumbar spine and how everything is moving back there. So I'd like you to reach down and touch your toes.